part 2 of our special episode on children and young people's mental health during lockdown, Chief Officer for Children and Family Services at Leeds City Council, Sue Rumbold, and Keir Shilaker, West Yorkshire and Harrogate Health and Care Partnerships Mental Health Lead, were joined by Sasha Baht, Head of Commissioning for Mental Wellbeing at Bradford District and Craven Clinical Commissioning Group, Jane Mischenko, Strategic Lead Commissioner for Children and Maternity at NHS Leeds Clinical Commissioning Group, and Karen Jessup, an educational psychologist based with Leeds City Council. They came together to answer some of the questions posed by young people during their conversation of this podcast in part 1. Starting with one of the facilitators of that conversation, Megan.
How are mental health teams supporting young people during COVID?
So it's probably a range of things to try and emphasise, I guess, more than anything else, is that it's a very tricky time, particularly in the early part of the pandemic, when we didn't really know what COVID was going to do to us as a kind of population, certainly to our kind of physical health and kind of the impact it was going to have. But despite that, it kind of throughout the kind of what are we in kind of months, 6 or 7 months since coronavirus kind of landed with us, it's important to kind of emphasise, I guess, that from mental health service point of view, each of our NHS provider organisations remain kind of open for business in the same way that they always were previously. They are accepting referrals, and they remain kind of there to support people who are in crisis and to do all they can to support people in there who have got existing mental health conditions, to kind of make sure they are supported in the right way. And there are differences, kind of the way in which services are provided has changed a little bit. So because of the requirements for social distancing, it's no longer as easy to see everybody face to face in the way that we'd like to, which means a lot more kind of telephone based, some kind of virtual appointments using kind of the technology that we're all getting used to now, kind of Zoom and Microsoft Teams and kind of things like that, which has been a real kind of improvement in a way for lots of people and their ability to access services. But at the same time, for those people who really do need support when they need it, making sure we don't lose sight of the fact that face-to-face can be used and is used when needed as well, really. I think another reflection is, it's not just the NHS services to talk about as well. Obviously, kind of we, from a West Yorkshire and Harrogate point of view, have a collaborative of mental health organisations, but we do know that in the early phase of the pandemic, when numbers were high of people who wanted to access services, but maybe they weren't quite feeling secure enough to be referred by colleagues, that lots of our VCS partners were also extremely busy in the early phase of the pandemic and remain so as well. So our voluntary and community sector organisations, so all those services are still around. It just the more support really, which will have changed for a lot of people.
I think in Bradford and Craven, what we've seen is having quite strong partnerships has been just the value and the bedrock of us coming together and working together to make sure children and people had access to mental health services. One of our key aspects of the Future in Mind work was to move some of our services to being digital services and having that digital reach. And that really just meant from the get-go, we had a really strong foundation to build from. We had really good and robust digital services on offer for children and young people. And we just made sure that those were then available throughout all our providers, and working together with providers to make sure that people knew where to get support, that the voluntary and community sector who were there frontline, who know their communities, know where people go to if they need support, that there was information available there. We just really worked together to make sure that was available. And then the other aspect of digital services is that it meant we had real-time information as to what children and people were accessing and what they were looking for and what they were needing. And so as a partnership, we were looking at that data and looking at that information to see that actually children and people were looking for information about feeling stressed, about feeling worried about school, feeling tense about family relationships, not sleeping well, not eating well. So those were the kind of things that then we worked with children and people to put together information and guidance and fun things to do, so that actually children and people helped kind of really create some fun packs that then our Youth in Mind team went out and delivered to young people that they knew needed those things. And so it really worked in a really proactive way of how we brought to life what we had, built on that, and then understood as a partnership where we had gaps. So we knew that there were children and people out there who didn't have access to digital tools, who didn't have access to things. So we worked then with other partners to see, well, how can we make sure that we can get tablets out to them? And so worked with raising funds and with our community sector, and we delivered 400 tablets to children and people who were isolated. And those tablets had things preloaded on them. So things like our Youth in Mind information, our Healthy Minds information, and things for them to do. And also we know that those tablets were useful for them for their schoolwork, which they were being isolated from. And when we think about Bradford and Craven, and we've got inner city areas where there's quite strong isolation, but also rural areas where there's isolation as well, just that connectivity to bring people together really helped. And so I think that's kind of how it was about listening, partnership, listening to what children and young people were telling us through our social media channels and the social media channels that our children and young people run themselves. That really gave us that rich information as to what they needed. And when we were in the height of the lockdown, we knew that children and young people were still saying that face-to-face support was really vital for them. And so some of our partners still did garden visits, street walks, and those street walks still gave us a huge amount of information, not just about children and young people and making sure that they were connected, but also knowing what was going on in communities and what was important for those communities, which we could then share with other partners. I feel like we, in that really first few stages of COVID, actually were able to really quickly mobilise, but then really build on what we had and make sure that we were providing services and support that children and people needed.
In Leeds, I know that we have developed our approach called MindMate, which is, again, as Sasha said, it's an online system. You can create your own version of yourself online as well, which is amazing. There is access in that service to support online, and we also have access to counselling services as well through this MindMate website. We also have MindMate ambassadors who have had real challenges from themselves in terms of their mental health, and they're very open and clear about how they think things should be improved. And that's absolutely what we do, is listen to those young people and how we can support better during COVID. We also have services which are commissioned to be provided in schools as well. And that's something that's really important right the way across the city. So there is support available, and we know this has been an incredibly challenging time. We know there's a lot of anxiety out there. People are not able to see their families, their grandparents, maybe being socially isolating for whatever reason, if their bubbles collapsed at school, or if they've been shielding, or somebody in the family shielding. There's a huge amount of anxiety. We understand that for young people. And the provision that Sasha's described and that we have in Leeds as well, and Keir's talked about across West Yorkshire and Harrogate, is about providing the access and support for young people at the right time and right place for them. Everybody's needs are different, and that's something that we're really passionate about, is ensuring that we've got the right care and support for children and young people right the way across West Yorkshire and Harrogate in the ICS.
Our next question is from Lois.
What do you think young people think that you are doing that you aren't? As in, are you doing anything that young people think that you are, but you're working on it, or you're kind of not listening to them? And how are you getting it across to young people? How are you spreading the word?
One of the things that I think that young people don't know we're doing is the government has given some money to all the different local authorities to fund some of this as well. But we've been doing this anyway, that we recognise that whilst there was this big lockdown, schools were open for some children, young people, but every child, young person would have to go back into schools or into settings, into colleges, into apprenticeships at some point. So we put quite a lot of work into supporting those adults and the relationships in the schools to make sure that they could identify and support emotional health and mental well-being. One of the things that we think that young people have thought we're doing is that they've recognised really clearly there's a mental health issue. And one of the things that was said that we needed more mental health professionals. We felt really strongly that alongside having the current provision around mental health and having access to it, that we made sure that the schools were really aware of the difficulties that might be there, but also the strengths of young people. And so we've just put a lot of work in to do some additional training, there's additional resources, and there's additional support from some of the services to make sure that school staff, whether it's the teaching assistant, whether it's caretaker, whether it's the teachers, or other people within school really do have a good awareness around mental health and what the importance is for those young people. So we're raising awareness in the schools and building that skill up. What we're hoping, some of the young people that spoke were talking about how important it is to have that contact with school as well as family and friends. But we know a lot of young people have got those connections in school and those relationships. So we just wanted to make sure that they were really strong and that those people understood their needs.
So I think that the young people mentioned MindMate, so that's a locally developed website, and that's been developed over the last 4 years by young people and parents and professionals in Leeds. And this provides information on a range of things. So it has what can you do to help your own mental health, and that's regularly updated and is really informed by what young people have found to be helpful, but also in conversation with professionals as well. It has blogs and real stories from young people and really very many blogs. It has resources that people, apps and recommendations that people can go and look at. And it also sets out the service offer specifically in Leeds. And there's some things that young people, particularly being able to talk to other young people is really important, I think, and realising you're not on your own. And many of the areas across West Yorkshire commission Couth, and the link to Couth on the MindMate website offers digital online counselling, but it also offers a forum where young people can talk to each other. It's a safe, anonymous setting, but they can see that other people are going through the same thing. So it's a really valuable resource.
The most important principles of the whole of the Children and Families programme is that the voice of the child and young person is at the heart of everything we do. So a great example of this is this podcast, because we were asked to do a podcast about the programme. So we went and asked young people to contribute, and we are responding to those contributions from young people, listening to what they're saying to us. Some incredibly powerful messages in here about how young people are feeling at the moment. And I just want to give a massive shout out to Kemi, to James, to Lois and to Anna. And thank you so much for your contributions, because there are so many powerful messages in here that everybody who's listening to this podcast will hear. And we are taking into our conversations, working closely with Keir and with Sasha and Joe and Karen and Jane, everybody else that you're hearing from on this podcast. We're really working together to get some great provision in place for you at a consistent level right the way across the ICS. And listening is the first thing that we do, and it's really important. So, you know, the MindMate ambassadors that I talked about before, they've stood in front of a huge range of politicians and senior leaders to say what it's like for them. And that's the most important part of this. And, you know, we are trying to feed back and be really open and clear about what we're providing in response to the input from children and young people. And I think that's the most important thing. And certainly in terms of how we're getting it across and out there through the MindMate website in Leeds, but also we're looking for this podcast to go out there, you know, right the way across the whole of the West Yorkshire and Harrogate system, utilising social media in a safe way. We've got for Child Friendly Leeds in Leeds. Bradford are doing similar things from what Sasha said earlier. So it's absolutely fundamental to the approach that we take, is having the voice of the child at the heart of everything we do.
Sasha, how are you getting that across, do you think, to young people in your area?
So I think it's a very similar approach to Leeds. So in Bradford and Craven, what we have some Healthy Minds apprentices. So these are apprentices that are from between the ages of 15 and 21 who support the work that we're doing and support then what we have as Youth in Mind ambassadors. So again, a very similar approach of children and people really driving and leading what we're doing, and our services being really designed based on what children and people and their families want to see happening, and really using real-time feedback to see what we can change and see how we can adapt to what they would like to see delivered. And we've definitely seen that happen in real examples during these past 6 months, where our crisis provision has moved from being just that crisis provision for children but also thinking about how do we support the parent and really widening that crisis support to the child and the parent, and seeing some really positive outcomes from that whole approach of not just looking at the child on their own, but actually looking at a family approach and siblings in the family. And that has really helped just think about wider, how are we working with people, and how do we work with them as a system, and work with them to make them feel good, to make them be engaged. A large part of what children and young people tell us is that they don't want services that take them away from their friendship groups. And so it's really about how do we create things that everybody enjoys, so dance, music, all of the things that young people love to do, that anybody loves to do in their communities. How do we make those accessible for everyone? So that's really helped drive how we work with children and young people, how they inform the type of information we create. They create the information for us. So it's really kind of helping resource them in a way that probably we haven't in the past, where we've tried to do things to children and for them. And actually they can really drive and shape things in a much better, much more impactful way. And we're really seeing that change in our services in Bradford and across Craven.
Keir, do you want to add anything from a system partnership point of view there?
Yeah, thanks, Ben. And it picks up a lot of what Sasha talked about, actually. Particularly, it really resonated, actually. I was kind of thinking as Sasha was speaking about the kind of siblings and the family point, which is something that I think I remember one of the very first things I went along to in this role, kind of, nearly 18 months ago, not quite, was a discussion about what we call our West Yorkshire children and young people's new care model, essentially, which is about how we are working across the system, so between each of our different places, to try and make sure that the least amount of young people go into inpatient mental health wards as necessary. So kind of we try and reduce the numbers of young people who actually have to go into our inpatient wards, but that when they do, they get the best possible experience. They're in there for the shortest possible amount of time, and when they are able to come out, they're supported and feel comprehensively supported in their community. And it's a session that I was reflecting on, which actually Common Room helped deliver, about how we designed that new care model, how we put in place certain roles that would help young people and families and siblings understand the journey they were on kind of jointly, about what it means to kind of go into those settings. And that kind of is really powerful thing that kind of still sticks with me, about that, not only the power of engagement at a point in time, but the power of continuous engagement with people, not just in their own journey, but about their reflections on those who will come after them as well. And particularly important from a children and young people's point of view, when we possibly even need to do more, actually, on reflecting on what it means when people become young adults, and reflecting on what their experience was like as a child as well. And some of the work that we're doing with colleagues in Leeds and with the One Adoption Service across West Yorkshire is also to understand what is it about the things that happen during a child's life that maybe make them more susceptible to kind of suffering with mental ill health, and how can we kind of spot those triggers and do a little bit more upfront to try and prevent it, really. And all that kind of stuff is really helpful to us, because it's helping shape what we think we need our West Yorkshire and Harrogate inpatient children and young people's unit to look like in the future. We're very fortunate, though it's taken a while to get here. We know that we will be able to open a new state-of-the-art service for children and young people in the autumn of next year, with more beds available, particularly some of the more intensive beds for people who really, really need support they can't currently get in West Yorkshire. They will be able to this time next year. But in developing all of that, it's been about the engagement with children and young people. What do they need to keep them well? What do they need when they're in the unit to give them the best chance of recovering, essentially, once they are in there? And how do we build our services around what children and young people need? And from a system point of view, it's critically important that, given that this is a unit that's going to be based in Leeds, it's a unit for West Yorkshire, and it's about the pathways into and out of individual places, whether a young person from Bradford coming into Leeds or from Kirklees coming into Leeds and then back out again, how all that works as seamlessly as possible. And getting that right is our job, to try and make that happen, essentially.
Karen, can you tell me a little bit about what's been going on in schools?
Every school has got access to some of our wellbeing for education training that some of the learning inclusion services are putting on. They should all have an identified lead, and then within that offer, they've got some training that they can roll out to all of their schools staff. And it's looking at how to build resilience and wellbeing implementation across the whole college school, so that it's not just one individual, but lots and lots of people within that structure, everybody understanding the importance. It also talks about bereavement and loss, understanding anxiety, low mood, that stress, and actually the fact that, as a lot of the young people in the recording said, they'd found some positives as well as some negatives and looking at the things that people had already found that helped them and give them that opportunity to share. But it also talked about how low mood, and this is draining for lots of people. And this is a normal response to an incredibly stressful situation. So there's also, alongside that, a few resources and links for staff in schools to be able to direct their children, young people that they're working with towards those links, but also so they've got a little bit more information to support them and give them a little bit more confidence to sit and listen. And we think that that's one of the really important things, that having that confidence and having that safety to be able to sit and listen and to say to young people alongside them, it is really difficult, and to share their own experiences. We've done quite a lot of work recently looking at a few case studies about how children, young people are feeling. But what we wanted to do was offer, and we have offered, first of all, some training and support. But in Leeds, what we're going to do is a slightly different approach from some other places. We're going to get some feedback from our schools and feedback about what young people in the schools are saying. And then we're going to tailor some of the ongoing support over the next few months to what those themes are that are coming back to us. So if there are schools that are looking for more work around what to look out for, those warning signs for children, young people who are in schools and settings, warning signs around when it does start to become overwhelming, or whether it's something around having a look at some of those more resilience factors, or even how to make spaces to have the conversations, and we'll be able to respond and support those.
The next question was from James.
We're all having to be innovative in that we've got new ways of living and new ways of working and stuff like that. So have they thought of any innovative ways we can improve our mental health during this period? Because a lot of the stuff that we feel like we could have done has been taken away.
We will ensure that this podcast is out in the system and encourage people, professionals, managers, leaders, to listen to those messages from young people. I think is absolutely critical to this. And also, how are we going to ensure that that voice shapes the service that we take forward? So, for example, we're looking at, as a whole system, at how we commission an out-of-hours crisis service so that young people will have somewhere to call, where there's professionals at the end of the phone who can talk to them if they're feeling really anxious, really stressed, really distressed, to be able to offer some support and guidance and encouragement to all young people. And we're doing that as a West Yorkshire and Harrogate ICS system. So we're working together, and we're going to commission that together. And that's innovative in the sense that we haven't done that previously. And so we're looking to an approach that every young person in West Yorkshire and Harrogate will be able to access this service. That's something that we're passionate about in terms of having the out-of-hours support. And often, when it gets into the evening time and you just need desperately to speak to somebody, that's what we're looking to put in place. So that's something that we're doing as a whole system together.
What's been really powerful about being led and having children's voices at the heart of our services has been really understanding what contributes to children and people not feeling well, what helps them get well, and what would they like to see to keep them well. And that message of really listening to children and people has really, as a system, opened up the conversation that children and people are having about the impact that the wider things around mental health that have an impact on them. So yes, and that lead to mental illness and can cause that. But those things around the impact of school on relationships, of bullying, of harassment, discrimination in society, that conversation that children bring to life in the way that it impacts on them has really opened up how, as a West Yorkshire and Harrogate partnership, we've started thinking about how do we work together with our local authority partners, with Mental Health Trust, and with our wider health and care partnerships. That really has opened up us to thinking about different models, how we work together as an integrated team, but also how that really embeds into our mental health support team work that we were seeing across Leeds, across Bradford and Kirklees and Colesdale, and some really exciting partnership working that's creating some new models of work that are coming out of that work. And I'm really excited about that, and just love the way that children and people shaped that to be about where they want to see help and what works for them and what kind of models they want to see. And that's really moved us away from thinking, well, this is how CAMS deliver their services and this is what we need to do. It's really pushed us away from that specialist-only model to really thinking about children and young people and support, mental health support for them.
It feels like, coming back to the bit about, you know, young people wanting to be taken seriously and kind of want to be part of the dialogue, really. If you kind of just reflect on all the stuff that's happened this year in particular, so not just the COVID stuff, but all that came with it, whether that be the whole A-levels kind of shakedown and fiasco. Before that, we had a lot of stuff about kind of the climate change rebellion and kind of a lot of young people really concerned about their own future, what that looks like. We had the Black Lives Matters movement stuff. We had Brexit going on. A lot of stuff for young people, which actually kind of feels quite daunting, and that's not and to try and identify that our approach in helping support young people in that isn't by trying to medicalize the problem necessarily at the outset. You know, if people need mental health services, they will need it and they will get it, but actually all this stuff is a challenge that we need to work through collectively to understand what is concerning young people about their future, and how do we understand that in the round, not just about single issue stuff, and go, how do we help support them on their kind of journey, essentially. So I think that kind of message is the sort of thing that we talk a lot about in different places and across West Yorkshire, about looking at young people as individuals, but a whole individual, and not that thing about kind of somebody who has a diagnosis or has an issue or has a problem or a concern. It's trying to really understand what makes them and kind of how we provide the right support.
The next question was from Anna.
What they recommend we do to help with our mental health in the pandemic in general.
Right at the beginning of lockdown, the NHS set out services that were absolutely necessary to continue regardless of the lockdown, and those that could be put on pause. And I'd just like to emphasise that mental health for all ages, so for children, young people and adults, was prioritised, that it absolutely must continue. All services across the piece, whether they are the kind of NHS CAM services or those third sector services that we commission in the city, have all been working really hard to make sure they maintain their support and offer to children and young people. Now, that obviously wasn't face-to-face in the majority of cases. They had to adapt swiftly and take up digital platforms to be able to provide that support. Sometimes it was, the old-fashioned phone was used, often digital means, so it's probably worth just saying that, but absolutely working really hard to make sure that offer is available. At the beginning of lockdown, people were not coming forward to many health services, not just mental health services. So people were not going to the hospital, to A&E, etc., to their GPs. Everybody kind of stuck at home and were a little bit anxious about what was available. So we have been doing a lot of communications, using social media, using the press, etc., saying our NHS is open to you, services are running, and we've been doing lots about please look at MindMate. Information is there about what's available, what to access.
I think that is something that we do need to get the message out to young people, is that ask. If you think that you might need support, ask for support, because the services are still running and they have been running. My teams from the Learning Inclusion Service have been supporting within schools for the whole time. There has not been a lockdown in terms of our support. It's just changed. And I think that at the time where everybody has moved back into the home, is not spending as much time with friends, don't hear about all the things that are happening out there, I think it makes young people and lots of people feel isolated and feel that there isn't the help out there. So I would say ask. And I would also say a lot of the support that you need, you already found within your friendship groups, within your family, and ask within those as well, because not only are you asking for help, but you're also sharing what you've got so you can support other people. But, ask, because definitely we are supporting, and the services are out there to support. They've not gone away.
Making sure that you sleep well. You think about what you're eating, so try to eat healthy, but enjoy the food that you do have, but have a balance to that. To always make some time in the day to do something that you really enjoy. To speak to somebody and reach out to speak to somebody if you want to, and that might be somebody you trust in your family, in your friends circle, or it might be reaching out to some of the support services that we have. Then there's things around building those connections and having a bit of a routine. So think about things that you do, but overall, above that is being kind to yourself, having kindness, compassion, and understanding that it's a pandemic and everything is not how it used to be or usual, and to not be harsh on yourself. And that's part of a bit of the campaign that the children and young people are building over the next few months, is around that kindness, compassion, and understanding. And so I'm really looking forward to seeing how that evolves.
I think absolutely support everything Sasha has said. And we are really keen to ensure that young people are aware of everything that's on offer. So all of the services that Keir described obviously are for young people who've got very challenging needs around their mental health. But for all young people, that kindness and compassion is absolutely key. Just maintaining connections with people is really important. So we had some really interesting contributions in the podcast around, my nana doesn't know how to use FaceTime, for example, so not physically being able to see people is really challenging for everybody. And I think we need to have a real understanding of that, and obviously support young people around ensuring that they can have as much contact as possible in a safe way, obviously, to ensure that they maintain that contact with family, with friends. Getting out and being physically active is really important as well. So what we're looking to do as a West Yorkshire and Harrogate ICS is to be really clear about what is on offer to all young people, to ensure that they can maintain great mental health. And I think the fact that we're talking about this is absolutely critically important, that everybody is clear about, you need to be able to say if you're not feeling great. As adults, we need to do that as well and be really conscious of that, and support young people to be able to be open and honest about how they're feeling. So I think there's something about messages getting out there in the way that Sasha described, and also our MindMate ambassadors, young people who've been through experience of having challenges around their mental health. We've loads to learn from their approach and how we can support young people. And it's something that, as a ICS programme, we're absolutely committed to doing, and ensuring that we've got that offer right the way across the whole of West Yorkshire, and also including Harrogate as well.
A lot of the young people talked a lot about feeling that government in particular, but kind of services at large, sometimes just don't take them seriously enough, or kind of don't give them the credit that they need as kind of young people, in terms of kind of being able to make decisions and be empowered to kind of look after themselves. As adults, we need to heed those same messages about kind of how we look after ourselves. We're trying to really do a really big push across NHS and health and care staff at the minute about where we collectively, particularly our frontline staff, aren't that great at coming forward and saying when they're struggling as well, but that really needs to be a kind of a message that we put a lot of stall by, and actually it's kind of giving that message to young people as well, that actually kind of the earlier they can say that they're struggling to their friends or their colleagues or their kind of family, that the earlier help can kind of be identified.
I've worked with children and young people in lots of different roles for the last 30 years. I thought that the 4 young people that you spoke to were incredibly eloquent. I think that they identified and they talked about things that I feel, and I'm 52, that a lot of people would identify with. And I thought they spoke in a really balanced way. And I think that the sense of the positives, the negatives, the sense of confusion that some people feel about, and that uncertainty, I think you really reflected the mood of our communities. I think there's a lot more that joins us that we have got in common than is different from children, young people. And I really appreciated listening to it. I think that more of this would be so useful.
And I'd like to support that. Just say how fantastic the facilitators were. So this is young people facilitating a focus group of young people, and how that draws out the richness and breadth and trust in having that conversation. And we need to be doing more of this, absolutely.
You've been listening to a special double episode of We Work Together, focusing on children and young people's mental health during lockdown. Thank you to Lewis, James, Anna, Keir, Megan and Gage, and in part 2, thank you to Sue, Jane, Karen, Sasha and Keir as well. And thank you for listening. Join us again next time, when we'll be joined by more people who work together to improve health and care for people in West Yorkshire and Harrogate.